My name is Michaela and I will be presenting the birthing customs in the United States and India. In this slide, I will be talking about birth customs in the United States. The different types of birth in the U.S. are natural, via the vaginal route, unassisted, which would entail going to classes such as the Lamaze method and Bradley method. Then you have assisted birth, such as C-sections, vacuum extractions, and forceps delivery, and then the locations they would occur could be hospitals, birth centers, and home births. Some statistics I found, according to MedicineNet, only about 2% of women in the U.S. opt for a home birth. Also, home births are attended by a certified professional midwife, licensed nurse midwife, or naturopathic midwife. Also, according to the Centers for Disease Control, about 1/3 of births are delivery by C-section, although rates are highly variable by hospital and region. In this slide, I will be talking about birth methods a little bit more in detail. The first option is at home, and this is a vaginal delivery with no medication, which has benefits such as fewer respiratory problems and a quicker recovery time for the mother. One of the breathing methods is the Lamaze method, and this is a controlled breathing technique and comfort strategies that can be used during labor. The classes would be attended by both the mother and the partner. Benefits include breathing reduces perception of pain and helps labor go smoothly. Then you have the Bradley method, which focuses more on preparation for a natural birth coached by the woman's partner. This would be taught over 12 weeks along with a workbook. It would help with teaching about nutrition and aspects of natural health. Some benefits would be it helps prepare parents for unassisted birth. Then a con would be the course would have to begin in the second trimester, and this could be difficult for some women if they're still experiencing sickness or anything else like that. Then you have water births, which is when the mother will go through all or some of the birth stages in a tub like a hot tub. This allows the baby to be born underwater or in different positions. One pro is it would help be less painful, being she's able to move around into different positions. The partner could also be in the tub to help support delivery. One con, though, would be people say it is a higher risk of infection because they feel that the water would be dirty. As long as the water is kept clean and fresh, it reduces the risk. Then you have hospital births. In hospital births, you can have a vaginal delivery, but have the option to have medicine or no medicine. C-sections are also done in the hospital and may be planned or unplanned. One con to hospital delivery is that you're rushed through stages of labor, which also, being in the hospital, could give you a higher chance of infection. Then you have birthing centers, which give people the best of both worlds because you have the home-like feel and have mind-body support options. These also include all of the different options already listed that could be done here as well. In this slide, we will be talking about the demographics of birth customs affecting women. Some complications that occur during birth are the umbilical cord being wrapped around the baby's neck or limb, the water breaking early, which, when this happens, labor should occur within 24 hours. If not, and she is near term, the doctor may try to induce her. If this occurs and she is around 34 weeks, she will be monitored in the hospital. Also during this time, infection plays a part because of the water breaking early and labor not occurring. Then you have labor not progressing, and with this, the doctors will try to give medications to the woman to speed up the process or it possibly inducing her as well. Then you have perinatal asphyxia, and this occurs when the fetus does not get enough oxygen while in the uterus, or does not get enough oxygen during the birth, or shortly after does not get enough oxygen. Then you have excessive bleeding, and this is one of the leading causes of maternal death worldwide. And this may occur shortly after the woman gives birth and is excessively bleeding or hemorrhaging and cannot stop. Some barriers women face in America when having a child are the shortage of providers, lack of insurance, chronic conditions they may face, and the over-medicalization such as C-sections. The U.S. national C-section rate is nearly 32%, which is very high for our country. Also, there are 11 million uninsured women ages 19 to 64 in the U.S., according to everymothercounts.org. This is a huge impact when it comes to women when women are pregnant or having births. In this slide, we will be talking about demographics of women in the United States and in India regarding birth customs. Two quotes that I had found off of Focus for Health were, "It should come as no surprise that racism, isolation, and social factors play a huge role, along with women in poverty, in having a higher chance of delivering a preterm baby or a child dying from SIDS." And then I also found, according to the U.S. Department of Health and Human Services Office of Minority Health, in 2014, African American mothers were 2.2 times more likely than non-Hispanic white mothers to receive late or no prenatal care, and African American infants were 3.2 times as likely to die from complications related to low birth weight as compared to non-Hispanic white infants. I found these two statistics very interesting regarding how women in poverty have a higher chance of delivering preterm babies or children dying from SIDS, when this occurs in a lot of women not in poverty or of certain social factors. And then as far as it goes with the second statistic, I found it interesting that they were kind of targeting the African American mothers and the infants in relation to the white mothers. Then I had found some examples on economicdiscussions.net about high birth rates in India. One of the reasons was early and universal marriages, and according to them, about 80% girls are married during the most fertile period of 15 to 20 years of age, which then pregnancy occurs shortly after. Then, it is a religious necessity among the Hindus that a male child is more preferred. This is because they perform certain religious rites that daughters cannot perform. So when a couple has a daughter, they're looked down upon because they don't have a son. Another interesting example is poverty and high infant mortality. And this is because poor people have to spend little on the upbringing of their children in India, and the children supplement the family income by engaging themselves in some odd jobs at an early age. As far as it goes with the high infant mortality, it's very high in India due to hunger, malnutrition, and poor living conditions. So the fear of early death of their infants encourages parents to have more children to replace the ones they lost. Also, there being a low supply of family welfare services correlates with the high rates of pregnancy because they're not they don't have access to contraceptives or to practice small family norms. On this slide, I will be talking about a study that I have found on the influence of culture and community perceptions on birth and perinatal care of immigrant women through a doula's perspective. Qualitative study examined the perceptions of doulas practicing in Washington state regarding the influence of cultural and community beliefs on immigrant women's birth and perinatal care, as well as their own cultural beliefs and values that may affect their ability to work interculturally. As immigrant mothers account for 23% of all births in the United States, birth and perinatal care for these women are important issues. Doula support is also associated with decreased maternal stress, more breastfeeding, greater self-esteem, confidence in mothering, and decreased likelihood of postpartum depression and anxiety. While language and cultural differences hindered immigrant women's full access to care, limited economic resources exacerbated the problem because their options were delimited by the confines of the public insurance coverage. Another quote I had found interesting in the study is, although many healthcare providers recognize the importance of culture when working with immigrants, one common pitfall is essentialization. When providers assign limited and generalized cultural understanding and meanings to an identified ethnic group, they gloss over the intricate within-group diversity as well as the complex social and historical contexts within which those cultural meanings may exist. The methods in this study was a qualitative study using a key informant interview method to understand phenomena from the point of view of participants and their particular social and institutional contexts. 11 participants whose individual experiences as professional doula ranged from 1 to 7.5 years were interviewed for this study. 7 of those participants self-identified as white, European, or Caucasian, 3 of them as Black or African American, 1 as mixed race. 8 of those participants were U.S. born, and 3 were immigrants from Peru, Somalia, and Venezuela. In addition to English, 6 spoke Spanish, 1 Somali, 2 French, and 1 both Japanese and Chinese. All but 1 of them worked with clients who were immigrant women of color from Asia, Southeast Asia, Africa, South America, Middle East, and Mexico. An average of 40% of their clients were immigrant women of color, and 45.5% were non-immigrant white women. Most immigrant doulas spent most of their time working with women of their own ethnic or linguistic backgrounds. Another interesting part I had found was when they were talking about what a good birth could mean, and what the bad births and everything else. So with this one here, it says a good birth could mean a natural birth or cesarean birth, because in their country of origin, cesarean surgery was promoted to upper and middle class women as the modern and medically superior way to give birth, whereas lower income women who had little access to such expensive medical technological interventions equated the traditional way, giving birth without medications or technological interventions, with a strong womanhood. Going back to the issue with the doctors, participants had expressed a strong concern over the lack of respect for low-income and/or limited English-speaking immigrant women's cultural preferences during birth at some hospitals. The providers disregarded women's culturally based wishes of if the woman wanted her body covered for cultural reasons, even though there was no apparent health care reason not to honor them, simply because doing so would necessitate providers altering their standard practices. They also found it deeply troubling when some healthcare workers treated immigrant women and their families as if they were charity cases that did not deserve the best services based on racial, ethnic, class stereotypes, or when healthcare providers imposed their own cultural beliefs and values on women and their partners. Because of this, participants had felt that community doula programs, which offered no-cost doula services to the low-income immigrant women, were essential in offsetting some of these disadvantages because it helped the women gain much-needed information, access, and advocacy. On this slide, we'll be talking about birth customs in India. And these in India are different because they're performed before the baby's arrival or up to a year after the baby is born. Some of the rituals are a Valakapu, or prenatal bangle ceremony, that occurs during the 7th month of pregnancy, which this is a confinement period after the birth for 40 days where she is only with her parents and they are caring for her and the baby. Also, you have Namakarana, which is a ceremony for naming the baby, and this is performed on the 11th, 12th, or 16th day of the baby being born, which is different from the US, where the baby's name is usually announced on the day of the birth. Also, in India, when a male is born, a thali, or a flat bronze utensil, akin to a large tray, is beaten with a stick by friends and relatives. This is a celebration of a male being born. In the case of a girl, a fan is winnowed or beaten because the families don't necessarily want a girl born due to the fact of Hinduism of being a preference for males. On this slide, we will be talking about ethical considerations and action. A couple of ethical issues for women when giving birth in the US are the forms they must sign of if they want medications during birth, and this could cause stress to the woman of having little knowledge of the side effects or if it would harm her baby. Another thing is when women give birth, they are asked if they want to breastfeed or if they want their baby boy to be circumcised, all of which have little information given to the parents at that time about the effects and the pros to them. I would find this overwhelming as a mother or a father about to have a baby or currently having the baby and being approached with all these different questions. In India, it surprised me to see that they had a commercial surrogacy where foreigners would come and give these Indian women money in exchange for carrying their baby. It is sad that they would do it to make money for their family to live the next couple months and be able to eat. For years, rent-a-womb services to foreigners had been big business indeed, generating nearly $1 billion annually, according to bioethics. Also, as of October 2016, foreigners are prohibited from renting Indian wombs, though it is doubtful this official action will shut down the trade completely and permanently. Big money talks whether the market is officially opened or closed. I found this ethical issue over in India very eye-opening, considering these women over there are working, struggling month to month, trying to make money, and then have these foreigners come over offering them $6,000 to carry their baby for 9 months when they wouldn't even be able to make that much over a several-year span. To kind of sum up of what I've talked about over the past couple slides, some barriers women face in America when having a child are the shortage of providers, lack of insurance, chronic conditions they face, and the over-medicalization such as C-sections. Also, some examples for high birth rates in India are having early and universal marriages, preference for a male child, joint family systems in India, poverty and high infant mortality, and there being a low supply of family welfare services. Also, you have the similarities women face when giving birth in the US or in India, such as social and economic impact that it has on women when they give birth. While women in the US are faced with ethical questions during birth, the women in India were renting their wombs out for foreigners that wanted to have their babies in a less expensive area.